In today's podcast, we are thrilled to host Dr. Bhaskar Rajakumar, consultant in public health strategy and program director at ARTPARK IISc. He will share the insights on how India is harnessing artificial intelligence to transform public health services, from cutting-edge AI applications to their impact on accessibility and efficiency. We will explore the evolving role of technology in revolutionizing healthcare in India and its global impact.
Thank you, Dr. Smita. It's an honor for me to be here on the podcast. I did my medicine, then did my master's. I started my own company, did my MBA, then raised funds, worked in Singapore, worked in a couple other Southeast Asian countries, then came back again to Bangalore. COVID happened. While volunteering and doing public health practice was one part of my career, the whole thing pivoted during COVID, where I started working from within the government. I was, for a certain duration of time, nearly 2 years, were heading the COVID war room for Bangalore city. So managing the whole city's COVID response was no joke, working within the government. So that is where I realized if you are in the center of public health, and if you're able to bring in some changes in accessibility, affordability, or the quality of care in public health, you'll be able to impact many more lives.
Correct.
So that was the real pivot in my career. From then on, I've been now working mostly in the public health space. From there, I moved on to work with this organization called AI and Robotics Tech Park, which is an organization fully promoted by the Indian Institute of Science at Bangalore.
Okay.
So where we are mostly looking at how can technology bring in many more changes in healthcare practice and delivery. So that's where I am now.
What are the major problems of Indian healthcare, and we are not able to solve it for last 77 years, and how AI is showing some hope in that aspect? So according to you, what are those problems?
So before getting into the problems, so I keep saying this, a little bit of fun part. AI has now become the aloo in every dish. Right? So I would go one step ahead and say AI is not even the aloo today. It's become the salt. You can maybe cook something without aloo also, but salt is a primary ingredient to give a little bit of taste. So whatever anybody is doing, there is some bit of AI today.
True.
That is what raises your eyebrows or even brings some attention to the ears.
Yeah.
Right? So having said that, let's look at India. If you look at India from the 1950s, where your early policies of public health were formed till date, we still struggle with basic problems. So access to healthcare itself is the biggest challenge.
Correct.
Right? So there are multiple numbers and multiple facts which quote that your doctor-patient ratio is really bad. We are still at around 900 odd ratio, right? So 1 is to 900 odd is the ratio still for really a long time now. So even though there are multiple medical colleges, new medical colleges which are opened up, there's telemedicine which is significantly catching up. Even with all that, if you look at access to tertiary care, so while primary care access might be getting resolved to a large extent, that too happens only till the town level. If you look at the smallest village level, it's a big challenge still. Tertiary care is still not at all accessible for almost like 50-60% of India.
Correct.
Right? So that is one part of it. And second part of it, if you look at the adoption of technology in healthcare, both with respect to general public and the practicing physicians, is a big challenge. So while we hear a lot about technologies in surgery, etc., like robotics and those kind of things, that adoption is happening. And where is it happening? It is happening at the tertiary care level.
Okay. Yeah.
In an urban level.
Correct.
But to enhance the access of healthcare, the kind of technologies which are required, their adoption is very limited still. So there needs to be solutions today which can come up and help early adoption, increase access, and improve the quality. All at the same time. Access to healthcare is the biggest challenge even today in India.
So how AI is actually helping? Take the example of accessibility or adoption. How you think that it is helping?
If you ask me, where should AI start helping? It should be healthcare first. Healthcare is a necessity, while many other things are convenience.
Yeah.
So we should solve the necessity problem first, then look into other convenience problem. But unfortunately, because of access to many other resources, your interest, funds, etc., there is a lot of work happening in the convenience space. Minimal work may be happening in the necessity space. We should focus a lot more on bringing AI kind of technologies in healthcare. The moment AI came up, all of us said AI will take away our jobs. The penetration of AI in radiology is the highest. So, will it take away jobs? That's one part of the trouble. Then, second is AI can never match human intelligence, compassion, care, etc. And all the way AI is being looked at by the healthcare community as a villain. AI should not be looked at as a villain. Rather, AI is something which should be looked as a friend. Now, just to give an example, if I ask anybody to identify two individuals who are identical in the world, will you be able to identify?
No.
Even the identical twins are not identical.
Yeah.
Right? So, if you go from their appearance and till their genetic structures, both of them are different. Will one disease behave the same way in two individuals? It never happens. There will be certain differences. But most of our treatment patterns is based on standard guidelines across. Is it applicable?
Yeah.
Yes, when you look at a population level, with little bit of variations, it's applicable. But with the growth of technology and with the growth of research, now it's time we customize our approach in healthcare delivery to individuals. So that's where AI kind of technology will really be helpful. That's where a lot of growth in AI is happening in cancer and those kind of care. Right? So it will help us understand our patients better.
But we definitely see that in last 1 or 2 years, quite a many startups are popping up for AI-related solutions. Do you think that during COVID time, many of the AI intervention happened and later gave us the door to probably what all things can be possible now and what all other problems that we can solve?
AI has been in the space for really long time. And there is a lot of work which was happening even before COVID. Yes, because COVID rather acted as a jump board for many of these things. While many startups and initiatives were focusing on non-healthcare kind of solutions, COVID got a lot of these people together to work towards healthcare delivery. So that's where we started seeing many more startups focused on healthcare. During COVID, there was universal focus to solve one problem, which led a significant shift towards main focus on public health kind of perspective. That's why we saw many startups. So to give a small example of one of the startups which initiated during COVID and rather became operational within a short period of time was XraySetu, which was developed in IISc by a group of engineers and researchers working along with doctors and radiologists. It's a very simple application where X-ray is taken, a digital X-ray. The image of the X-ray is uploaded. It works on WhatsApp. If I take an X-ray, I have cough, I can upload that on WhatsApp and ask the chatbot, can you diagnose? If it is COVID, it will tell it is COVID and I can take an opinion from the physician kind of thing.
Okay.
So this worked on a simple machine learning kind of a model which will go analyze a lot of images. XraySetu was built on an image dataset from NHS and other data sources where it could analyze and give me an output saying it is COVID. This is the probability. This might be COVID. You need to consult a physician.
Okay.
Which solved a real problem, and the application was developed and delivered within a period of a week to 10 days.
Oh.
So these kind of solutions started coming up a lot. After XraySetu, the same team now has moved on to develop multiple other healthcare solutions. They moved on to develop many more healthcare solutions.
Got it.
That's how COVID helped.
In tier 3 or 4 or smaller villages, we cannot have access to the radiologist or somebody who can give me the immediate diagnosis of any image. So similarly, now if XraySetu we are not into COVID setup, but are we still using that for?
Yeah, XraySetu in itself is not functional now. At this point of time, there are multiple other solutions which have come out now. So radiology is one of the areas where AI is extensively used. Now there are AI models which can give you up to 95%, 99% accuracy the diagnosis of an X-ray or a CT scan, which is many a times much better than a radiologist himself looking at the image. So that has already happened. ECG, like you rightly mentioned, there are multimodal GPTs itself available online freely, where you can upload your ECG and it will give you a diagnosis today.
Correct.
That is how the technology is expanded today. So moving from COVID into other initiatives, while XraySetu was one of those kind of initiatives, very similar image-based analysis initiative, what we are continuing to do at ARTPARK itself, working along with large institutions like AIMS and other kinds, is we call it as a medical imaging datasets for India.
Okay.
It's MIDAS. What we are trying to develop is gold standard datasets. Why are we doing it? It's a very important problem to solve. Because if you look at startups today in India, you might have heard about a lot of startups who have come up and who are using mobile application. Today, accessibility to mobile is there to the last person. So considering that, a solution where you take image of a wound, image of skin, it will tell you if it's a particular condition or not, is a very common thing today. There are multiple applications available. But what is the level of accuracy of this? What is the data which has gone behind these applications is a black box still for a lot of people. As a matter of fact, today most of these applications are developed using data from international sources, because availability of Indian data which can be used for development of such kind of solutions is very limited. So because of that, there is a lot of international data which is being used. What happens with that is there is a lot of bias. So we are only what we have learned, and AI is the same. Right? So it only learns on data what is fed into that. If I feed only data from international sources, if it has only Caucasian images, if I use the same Caucasian source to detect something on an Asian origin or an Indian origin, it may not be perfect 100%, right? So the accuracy levels will fall significantly on the ground. So this is one problem what we are trying to solve. Similar to what XraySetu was doing while we are taking X-ray images. Here we are taking multiple kind of data sources. And also what we are trying to do is define what do you mean by a gold standard data set. If I am a startup today, I want to develop an application which will help me taking an image, diagnose oral cancer, diagnose a dental caries, simple things. So these are kind of specific metrics what we are working out with ICMR and AIMS kind of organizations to see if we can define these standards so that it becomes easier both for doctors and startups to build better applications.
Correct.
One similar application is something what we recently started testing out in the market for diagnosis of, for screening of oral cancer. So oral cancer is a very big problem in India. And it is a India specific problem. So oral cancer is not a big problem outside of India because we have a problem of tobacco chewing, smoking, etc. Right? So if we can screen oral cancer at a very early stage, we should be able to cure many more of them. So this is what the application really does. So ASHA workers or your field level workers who are there can use such kind of an application to just take photos of the mouth and up to around 80-85% is what we are looking at accuracy right now. It can screen and tell what is the probability percentage of that person having a oral cancer.
Beautiful.
So this is at a very early stage, right?
I agree that data is not available, but I believe that you work quite closely with the institutes, and now there is a change where it will help to access the information that is available.
What has happened with time, and of course post-COVID, it has opened up many more doors of collaboration. So today, like where I work within the Indian Institute of Science, there are a good number of doctors who are coming in and working within the Indian Institute of Science. And similarly, there are a lot of engineers who are working along with a lot of hospitals today. So on data science related innovations and things what can help them in enhancing the delivery, etc. Which has led to a lot more meaningful innovations which have come in, which are getting implemented and tested and tried out in healthcare delivery and practice. So some of them which have done really well and gone really global are, you would have heard of Qure.ai. Qure.ai is doing really well in the space of radiology. They are again gone multimodal in tuberculosis diagnosis, etc., where they're analyzing not just X-rays, but also along with X-rays and CT scan, they're analyzing patient data, etc., to come up with better predictions on diagnosis on using X-rays. Niramai is another big startup who is solving a very big problem for women. So here in India, especially when we talk about some concerns which are very specific to women, something like a breast cancer, there's a lot of stigma associated, and also women are not open about discussing or even getting diagnosed.
Yeah.
So it's very easy to say, go get a scan done. For a woman to go get a mammograph done, it's still not so comfortable for women.
Correct.
Here, right? So where Niramai has come up with a fairly simple application where they're using a heat scan kind of a application and using AI to diagnose, rather screen for breast cancer, and it will help screen for breast cancer at a very early stage.
Correct.
So it will help diagnosing the risk of breast cancer in women much earlier, and also without them getting a mammograph. So it can identify and tell which women need to go and get a mammogram further.
The
And
early
also
stage
there is lesser stigma associated with it, and it can be done in settings like a public healthcare, primary healthcare kind of setups. You need not go to a bigger hospital kind of setup, which is helping solve a very big problem of screening and early diagnosis of breast cancer. There are a lot of problems what we don't even talk about. These are mental health problems, right? So we as doctors know how big an issue it is.
Yeah.
But when you speak to a lot of general public, and including us as adults, we try to write it off. If somebody comes and says, I'm feeling sad today, it's like, it's okay, you'll feel fine. Maybe not. And what has moved on is people have become really comfortable talking to applications today. It can be just WhatsApp. We are so comfortable talking to people on WhatsApp.
Yeah.
We are not so comfortable today talking to another person. Similar thing has happened with respect to mental health startups. Wysa is one of the startups which is in that direction, where they're using AI-driven models to help connect and rather screen for mental health diseases. Last time I spoke to them, they were running large clinical trials to understand how the software is functioning with respect to the accuracy and specificity, sensitivity, etc. They have been using a lot of sandboxed data to help and suggest what should be the next action when they identify anybody with a mental health condition. They have been doing really well. So there are multiple such kind of solutions. We were just chatting about the diabetic foot and kind of problems what we have. This is again a very big problem in India, but we don't talk about. There's a limb getting amputated every 20 seconds. Most of it is because of diabetic foot. And India is the diabetes capital of the world. Having said that, most of us neglect when there is a small wound in my foot going to a doctor because it might cost me high or you don't know where to go to, etc. There is a startup which we are supporting through ARTPARK and developed by a podiatric or a foot surgeon, which helps you identify if a wound is a diabetic wound, if a wound is actually improving with time or worsening with time. Should I consult a specific kind of a doctor or what am I supposed to do with the specific wound? And it also helps you tell what kind of footwear I'm supposed to wear. So these are kind of some examples of startups which have used AI in multiple levels to help real world problems.
Okay. When we look at India is a different case scenario altogether. Will it not be very difficult for AI to actually solve the problems for India when we speak so many different languages in so many different areas?
Wonderful question there. And also, if you look at the diversity of India, it is a real problem. So that is where your large language models are coming into picture. There are multiple solutions which are working today on large language models, which is a significant problem. So that's where your language-based solutions help. That's where AI can really help solve some of these healthcare problems. Again, one of the solutions which we have been working closely is called Arman. So Arman is an initiative currently being piloted in Telangana, which helps connect your field level healthcare workers like your ANMs, and your ASHA workers who are in touch with pregnant women, right? So they might have a lot of questions which are more medical, like the difference in a heartbeat or movement of the fetus, etc. Especially in high-risk pregnancy cases, which they need to monitor closely. They may not be aware or knowledgeable enough to answer them. So the chatbot helps them answer those questions, not only in English or Hindi. It can answer in their own language. It can be in Telugu, it can be in Marathi, it can be in Kannada or Hindi, whatever. That's not the beauty of it. While that can be done with a lot of LLMs, India is again diverse if you look at the way we use language. While we speak Hindi in a specific way in Uttar Pradesh, the Hindi spoken in Bihar is significantly different. You move a little further away and speak in Jharkhand, it is again different, right? So that's where dialects come into picture. While that's one part of the challenge, most of us don't speak the language completely in that language. So if I'm speaking Hindi, it's usually English.
Correct.
Right? So there is a lot of mix of 2 languages, 3 languages coming in. What we have tried to do with a solution like Arman is taking into factor all of these things. If a person asks the chatbot in Telugu mixed with Hindi, Telugu mixed with English, it still is able to understand and respond to you.
Oh, nice.
So that's when you can get really close to the community. So if it can understand only in pure Hindi and not in the language what I speak,
correct.
I might not like it. So I'll feel it's a robotic system which is responding to me and not really a person.
Yes.
Right? So that's where we are trying to work and solve language kind of problem.
Wow. Okay.
That's how Arman is really helping now. While this is happening, there are multiple solutions. Recently, just last week, I was at Udaipur looking at a similar solution there. It's called Asha Saheli. Asha workers are given an application which they are conveniently able to use asking specific queries. For example, if they want to understand, if they have a pregnant lady sitting in front of them and the pregnant lady's hemoglobin is around 7%, Asha worker can ask the chatbot and say, मेरे सामने एक pregnant lady बेटी है, उसका hemoglobin 7% है, उनको क्या क्या खाना चाहिए? And it responds in Hindi, specifically mentioning what all she's supposed to eat. Which both of them are able to understand and conveniently follow. So these kind of solutions are really helping at the field level and giving them a lot more comfort and convenience. So while these are examples what I'm giving, which is easy to answer, some problems which they can really solve for women and communities which are hard to reach can be with respect to birth control. People on the field or rural population are still not so comfortable asking these questions, be it to the healthcare worker or to the doctor. Chatbots can be the solution. Mental health problems.
Yes.
They may not be conversant enough to tell what's happening in a different language. If you ask me to explain my mental health problems in English, I might be comfortable. But my patient may not be comfortable. They might be comfortable in Kannada or Hindi.
Correct.
So that's how these things can really solve the problems when it becomes application which is conversing with you in your own conversational language.
From the startup community listening to our podcast, and they are thinking, they are just like ideation level, and they're thinking they should get into something AI, try to solve the healthcare problem. What a startup should think about and where they should focus, what should be their path, and how they should take help from the government.
So if there is a startup who is looking at venturing into AI in healthcare, what I would suggest is they should, as a first step, talk to some of the healthcare practitioners, talk to some of the doctors and get a validation of the problem. So what they are thinking as a problem for a healthcare practitioners may not really be a problem at all. Right? So you'll have to talk to them and figure out what is the real problem and then proceed with your solution. Also understand what is already happening with respect to technology in different parts of the world. So what kind of technology is helping healthcare delivery, access or outcomes should be understood before venturing into AI in healthcare. Just looking at AI in healthcare and coming up with similar solutions may not be the problem to solve. Like today we have a lot of chatbot, today we have a lot of screening applications, etc. but most of them die a natural death, being one more app on everybody's phone, and eventually they'll all go.
Correct.
So that should not be your motto when you're developing a startup. Can you really solve a problem which is troubling people? Should be one of the solutions what they should focus upon. If you ask me where they should invest their time upon, is two primary areas: improving the quality of data, availability of data is one area which is really needed, at least in India. So how can you enhance the data quality from data collection at the primary point to data storage and data access? AI will only survive on data. The food for AI is data. So you need to improve that layer first. I would urge a lot of startups to put in their time on building these things and building AI models.
Correct.
So second is the language space. So language is a very big elephant we need to answer. So that's one thing which will solve the India problem for sure. Whatever said and done, even if we try really hard, you cannot cover the whole of India with one or two languages. It's impossible.
Yeah.
So, and we need to work a lot on dialects. So initiatives from the government like Bhashini, etc. have been really helpful in collecting a lot of data sets of language and dialects of language. There are a lot of funders who are supporting such kind of initiatives. And if you look at specific areas or fields within the healthcare practice, two things what I would still urge them: while there is a lot of work happening on precision medicine and non-communicable diseases, infectious diseases, etc., two areas which is causing a big load problem for India is, of course, the public health, where we can enhance access of care. Second is OPD care. Our OPDs are super overloaded. So if you can solve some problems in the OPD, plus if you can solve some problems on the field where public health access. So these are two areas I would say needs a little more focus as compared to other areas.
Okay. And
so if we look at how government is actually supporting a lot of these startup initiatives, today, both at the state level and the national level, there are multiple initiatives across sectors which is helping a lot of startups. Couple of examples what we have been doing, at least at ARTPARK and similar institutions within the IISc, is there are incubation opportunities and grant calls. So these are huge grants which is to support startups, especially at idea stage. If you look at a lot of VCs, venture capitalists outside, me being a funder and supporter outside also, when we are looking at startups in the outside world, we look at startups who can or already generating revenue, who have proved they can survive.
Yes.
Right. So, which is not the scenario when we are looking at startups in a setup like ARTPARK. We look at essentially idea stage startups. So, who have an idea which is convincing enough, which is solving a real problem. We call them as pre-ventures, not even a venture, who come with idea. So we usually say we find the founders.
Correct.
So, well, founders are the ones who come and talk. These are kids from colleges or usually a group of people who come with an idea. Then they come up and they form a team. That's how the founders come together and eventually become a venture over a period of 2-3 years. So there is good amount of money, like a couple of crores, which is funded every year to them before they become an actual startup.
Okay.
During this journey, there is a lot of support beyond just the money. You get a space to work from, you get a lab where you can develop if you're developing something, you get access to mentors from premium institutions of the country. All these things are provided, and all of this is provided through the government initiative. So I urge all of these startups to make use of all of these initiatives, especially in the space of AI. There is a lot of money, a lot of resources, a lot of support from government initiatives.
Whenever we discuss about the startup mindset, we do projections regarding revenues, 3 years down the line, EBITDA, 5 years down the line, what's happening. Whereas I also urge startup community to, when they are dealing with healthcare, also look at the number of patients cured, number of patients treated, and the patient outcome, epidemiological outcome, prevalence, incidence, than actually just looking at only number of patients accessing my the startup solution that I have created. Healthcare works differently. It should not work only on Excel. And Excel should not have only the revenue numbers, but it should also have the prevalence, incidence numbers. That how many cases I'm able to solve, which I feel that it's missing in this startup mindset. At least probably where I have access, but I'm sure that where you are accessing, you're already encouraging him to look at that way, right?
Of course. So when you are looking at metrics, number of lives you can touch is one of the primary metric. So especially when we are looking at public health solutions, right? So when we are talking about public health access, you need to look at population scale outcomes. So how many lives can you really touch? How many lives can you really impact? How do you measure all of this? All of them have to be answered in a way when you are looking at developing a AI-driven healthcare solution.
Doctor, tell me about Prism Edge. What exactly it is?
Yeah, so Prism H is a abbreviation acronym for Platform for Research Integrated Surveillance and Management of Health. So it's a broad initiative to build platforms which can help in close monitoring and providing a early warning of diseases of public health importance.
Okay.
It is initially piloted and launched in Karnataka, taking in dengue as one of the case scenarios. We all know dengue is a very big problem across India and many other countries across the world today. And what is also happening is dengue was a very seasonal problem till recently, but now it has become like a all through the year kind of a problem.
Correct.
Why is it happening is because dengue is very closely affected by the climate change. It's a climate sensitive disease, and mosquito breeding, etc., is closely related to the climate change. So we wanted to build something based on the platforms which were developed during COVID. A lot of technology got developed during COVID, but most of it died down post COVID. So we thought, why not utilize that kind of technology and also the access to resources and build something which is a constant, not something which is temporary during an emergency and goes off, a constant, maybe not at the scale of when COVID happened, but have it ready.
Correct.
And when it is required, it is expandable. So that's what Prism Edge is. It's more on the lines of pandemic preparedness. So if in case there is an outbreak, if in case there is an epidemic, if in case there is a pandemic, you have a small model which you can plug into the existing healthcare systems and expand upon that. Prism Edge application for dengue management in Karnataka is helping out the government today on multiple levels. One is at the data collection level, larval survey level, understanding and identifying larval breeding spots. On top of that, it is taking into consideration climate factors, people mobility factors, land use, land cover factors, etc. Plus, of course, the dengue case data to give predictions. So what it does is, if I'm a medical officer sitting in a primary healthcare center, it gives me access 4 weeks ahead of time to tell me if my village might have an outbreak of dengue 4 weeks from now. So that I am prepared what all I need to be ready with. So do I need to stock more medicine? Do I need to inform the hospitals? Do I need to test more? Do I need to do surveys more? So all these things I can be prepared so that I can prevent the disease spread. This is what it is right now. As we speak, it is getting expanded to multiple other states. We are looking at expansion across India. We are in talks with multiple other countries where we can technology can be expanded also. It can be expanded to multiple other diseases where it keeps the administrators and doctors and physicians who are implementing healthcare solutions ready ahead of time.
If I'm a doctor, I have a general practice, and I'm listening to this podcast, how I should prepare myself so that tomorrow if some AI integration is happening, it's helping me, how I should make myself AI ready as a primary physician.
So if you're a primary physician, you need not be AI ready. You're already ready. AI needs to get ready to come to you. So you are the one who are training AI.
Correct.
So what I would suggest is, don't be averse to technology. That's all needs to be done. Technology will come to you. Today, if you're a physician, wherever you are, tier 2, tier 3 or no tires, you will be using a mobile phone. Of course, right? So if you are using mobile phone, AI is already penetrated into your daily practice. May not be in medicine yet, but into your daily practice, it is already come in. So you need to understand as a physician how AI is changing my daily routine. Eventually, the routine will also include your clinical practice.
Okay.
So that is how I need to prepare myself. Like the way we pivoted from using message to WhatsApp, in between multiple things came and went. Today we are so comfortable chatting on WhatsApp. Similarly, how we have been using prescription pads and writing to electronic health records to your e-sanjeevanis, electronic consultations, etc. Eventually, AI-driven solutions will become a norm in your primary practice.
Correct.
We need to learn, we need to understand, and also be adaptive enough to accept them.
But when it is making so accessible, even if I'm ready and other things, what about the data safety, data protection? Are there any laws, regulations that are there, or how we are looking at that?
So, very good question. So, if we are looking at solutions which are driven by AI and talking about rules and regulations, today there are some acts and regulations which are around data security. So, the recent one being the DPDP Act. While it is a very broad act, can it really answer today's artificial intelligence startups and solutions? May not be 100%. Can it really answer the healthcare data security? May not be 100%. But there are discussions happening. There is some progress on developing or even coming up with advisories and regulation which will help framing such kind of solutions.
True. But then me as probably a patient or probably a caregiver or a family person, is my data so important? Like why I should be worried about data protection? If it is somewhere, if I just keep chatting with ChatGPT about my mental health issues, do I need to worry that it's going to use it somewhere against me? Why the data protection is so important for a common man or a woman?
If you look at data protection from a person perspective, it is really important. Even before talking about data protection, it's really important for a common citizen to understand what do we mean by my data. My data can be anything. So today we are so careful about our financial data because there is a lot of awareness built in around financial data, right? But so much of awareness is not happening about your healthcare data.
Correct.
So your healthcare data is also your currency, which is very, very important. People can encash your healthcare data at multiple levels of multiple things. So it's very important for me to understand my healthcare data. And it's also very important when I'm sharing my healthcare data with any organizations, how are they going to use it?
Okay.
So what I urge any listener or a doctor or a patient, while they are sharing their data, speak to your healthcare provider and check with them how are they going to use this data. Will they be sharing it on any platform? Will they be using it for research? Which is very, very important. We converse and explain how this data is going to be used so that both parties understand the strength of healthcare data. Once we understand that, then we'll automatically be aware of my data privacy, data protection, data storage, and what are my rules and regulations as a data principal or a data fiduciary.
Wow. Like my last question for today's thing is, we started with what are the problems that India is facing. Is AI giving any hope to solve at least few problems, if not all? What do you think? As a country, where are we? And how far are we from taking the help from AI to solve our problems, integrating AI in our healthcare system? And how many years it will take, or where are we? What's the status? You speak on, you are closely working with government, so probably you have the answer, I don't.
Maybe, maybe not. I have the answer. So before that, I am an eternal optimist. So for your question, does AI have answers to many of these problems? Being an optimist, I'll say yes, AI does have a lot of answers. Will we be able to solve all the problems? Maybe not. So some problems like your compassion in care cannot be solved by AI, which we need to be really aware of, right? So compassion in care cannot be solved. But access in healthcare, it can be solved using AI. Accuracy in diagnosis can be solved by AI. So these are some things which AI can really solve, which are today a big problem for India. So, having said that, if you ask me where is India on a scale of 1 to 10 with respect to AI implementation at multiple levels, it would probably be somewhere around 3 or 4. So, there's still a very long way to go. But what is a positive thing about being in a country like India today is there is a lot of push from government. There's a lot of interest among the institutions, and there is also a lot of emerging technologies which is trying out India as a market. Because all of this is happening together, we might have solutions coming up in India much faster than many other countries in the world.
Correct.
So, which is an advantage. So, beyond all of this, the kind of population diversity and the data what you have in India, which is a gold mine, which you'll never be able to get in any other country in the world.
Correct. Based on what you said, if the startups are coming up with a solution for Indian problems, I think there is quite a good possibility that they will be able to extend that solution to the global countries, even the developing countries, right? Do you think so?
Yes. So, there are some problems which are Indian problems, some problems which are fundamental problems across the world, and there are some solutions which can only solve certain problems, and some solutions again which are more fundamental. So, what I would suggest startups is look at solving problems of India with solutions which are more fundamental. So, while this fundamental solution can be applied here to solve a particular problem, you should be able to use the fundamental solution to solve a different problem in different part of the world. Then you will yourself become available to the rest of the world. So ideal is look at a broader solution and solve a specific problem.
Thank you so much for your time today.
Thank you very much for giving me this opportunity. Thank you.
Thank you. Bye-bye.